Hey people, I wish you all a very pleasant day. Welcome to Tooth Spell. Let's learn science behind the art. Today we are going to see 10 most important topics of anatomy which we must remember on every day we practice dentistry. Before that, let me talk about the popular issue a dentico met or will be meeting. On hearing the word anatomy, people who passed out first year may think, actually, anatomy? That subject which I studied with interest and had many struggles to remember. And those in first year may have many dreams about it. At the beginning of first year, we will be very keen about every subject and will be happily reading it. The real struggle will start only on the day or week before exam. The demon which slept peacefully for the entire year will pop out and questioning you like, hey, we are going to treat only the tooth, right? Then why are you struggling to study these blood vessels and stuff? Just mug it up. You don't have to do research on it, okay? Why anatomy to a dentist? Will it going to help you in future? Then why are you reading it? Have you heard these words anywhere? Then don't worry. You are very much normal. Do you want to know answer for these questions? Then just imagine. You are at home and you need to eat food at right time. So what should you do? You should know and understand about your family members to have food peacefully. Then you are walking out of your home. You should know and understand your neighbors to cross them without struggles. Likewise, to treat a tooth, we should know and understand about its housemates and its neighbors. So in this video, we are going to see about the tooth's housemates and its neighbors. The 10 most important topics of anatomy that a dentist must remember on everyday practice are 2 bones, 1 joint, 1 nerve, 1 artery and 4 muscles. Want to know what these are? 2 bones, maxilla and mandible. 1 joint, temporomandibular joint. 1 nerve, trigeminal nerve. 1 artery, maxillary artery, which is a branch of external carotid artery. 4 muscles, muscles of mastication, which are masseter, temporalis, lateral pterygoid and medial pterygoid. Hey, wait, you got right. There are only 9. So what's 10? As 10, you have 2 components which are maxillary sinus and facial nerve. So for today, we are going to see trigeminal nerve as the first in the sequence. Trigeminal nerve, which is the 5th cranial nerve, a mixed nerve with both motor and sensory part, and the nerve of first brachial arch. This nerve provides general sensory innervation to face and motor innervation to muscles of mastication and 4 other muscles. Dealing with the branches of trigeminal nerve, there are 3 branches: the ophthalmic nerve, maxillary nerve and mandibular nerve. Let's start with ophthalmic nerve, which leaves the cranium through superior orbital fissure. It has only the sensory part and it again divides into 3 branches. Just to remember, have words like let's find nerve. Eye is the only organ which helps us to find anything. So ophthalmic, which means eyes. Let's find nerve is for lacrimal nerve, frontal nerve and nasociliary nerve. Lacrimal nerve supplies lateral part of conjunctiva, lateral part of upper eyelid and the lacrimal gland. Frontal nerve, it again divides into supraorbital branch and supratrochlear branch. Supraorbital branch supplies middle part of conjunctiva, middle part of upper eyelid, skin of forehead, and skin of scalp till vertex. Supratrochlear nerve. It supplies medial part of conjunctiva, medial part of upper eyelid and skin of forehead above nose. Nasociliary nerve. It divides into multiple branches. Anterior and posterior ethmoidal branch which supplies ethmoidal ear sinus. Infratrochlear nerve which supplies skin of root of nose. Internal nasal branch which supplies mucosa of nasal cavity, and 2 long ciliary nerves and 1 ganglionic branch. Maxillary nerve V2 which leaves the cranium through foramen rotundum. It also has only the sensory part and it gives branches at 4 different levels. To make it simple, let's relate maxillary nerve to master. So our maxillary nerve is a master nerve. And there is a famous Tamil saying like ஊருக்குள்ள நம்ம என்ன பண்ணாலும் 4 விதமா பேசுறதுக்கு 4 பேர் இருப்பாங்க, which means there will be 4 people around you who will be criticizing you on every action. So our maxillary nerve also has these 4 people where it gives branches. So first is in cranium, second is in pterygopalatine fossa, third is in infraorbital canal, and fourth is in face. The first branch is given off in cranium. The first person to criticize you will be your brain. உனக்கு எதுக்குடா இந்த தேவையில்லாத வேலை அப்படின்ற கேள்வியே அவன் தான் கேட்பான். So in cranium, meningeal branch is given off which supplies dura mater. The second set of branches is given in pterygopalatine fossa. The people who live in your territory will be criticizing you. அதாவது நம்ம தெருவில் பள்ளத்துக்குள்ள நின்றுட்டு நம்மளை பற்றி பேசிகிட்டு இருப்பாங்க. Here there are 3 branches which are pterygopalatine ganglionic branch which again divides into 4 divisions. Orbital division which supplies periosteum of orbit, nasal division which gives nasopalatine nerve which supplies mucosa of anterior hot palate, palatal nerve which again divides into greater palatine and lesser palatine nerve which supplies mucosa of posterior hard palate and soft palate. Pharyngeal branch which supplies pharynx. So second branch will be posterior superior alveolar nerve. It supplies posterior and posterolateral wall of maxillary sinus, buccal mucosa in maxillary molar region, facial mucosa of adjacent tissues, third and second maxillary molars, first maxillary molar except mesiobuccal root, and the alveoli and periodontal tissue in the surrounding. So the third branch will be zygomatic branch which again divides into zygomaticofacial branch and zygomaticotemporal branch which supplies skin on cheek and skin on the side of forehead. The zygomatic nerve also gives secretomotor pathway to lacrimal gland. The third set of branch is given off in infraorbital canal. The people who lies within your eyesight, infraorbital, will be criticizing you. நம்ம கண்ணுக்கு எதுக்கவே நம்மளை பற்றி தப்பாக பேசிகிட்டு இருப்பாங்க. So here there are 3 branches which is middle superior alveolar nerve, anterior superior alveolar nerve and infraorbital nerve. Middle superior alveolar nerve. It supplies maxillary premolars, mesiobuccal root of maxillary first molar, periodontium and the alveoli of that region, buccal soft tissue in that region and the bone. Anterior superior alveolar nerve. It supplies maxillary central and lateral incisors, maxillary canine, periodontium and alveoli in that region and buccal mucosa in that region. The fourth set of branches is given off in face. People who start criticizing you directly in front of your face itself. How awkward it is. அவங்க நம்ம மூஞ்சிக்கு முன்னாடியே சொல்கிறாங்களாமா, அப்படி சொல்லிட்டு போயிடுவாங்க. So here there are three branches, which is the branch of infraorbital nerve, which is inferior palpebral nerve, which supplies lower eyelid, external nasal nerve, which supplies ala of nose, and remaining region which the infratrochlear nerve doesn't supply, and superior labial nerve, which supplies upper lip. Mandibular nerve V3, which exits the cranium through foramen ovale. It is a mixed nerve, which means it has both sensory and motor part in it. It again divides into three branches. To make it simple, let's consider mandibular nerve as man. To the extent I know, men prioritize three things as the most important things of their life: career, family and friends, and peace. At first, they should have career, which is the anterior division, and in middle they should have family and friends, which is the undivided main trunk, and at the end of the day they should have peace, which is the posterior division. So undivided main trunk of mandibular nerve divides into nervus spinosus and nerve to medial pterygoid. Nervus spinosus gives meningeal nerve, which supplies dura mater again. Nerve to medial pterygoid supplies medial pterygoid nerve and also tensor veli palatinae and tensor tympani. In anterior division, it has deep temporal nerve, which supplies temporalis muscle, masseteric nerve, which supplies masseter, lateral pterygoid nerve, which supplies lateral pterygoid muscle, buccal nerve, which is a sensory nerve in this division, and it supplies skin of cheek and buccal gingiva of mandibular molar region. The posterior division of mandibular nerve has three branches again, which is auriculotemporal nerve, which supplies skin over helix, skin of tragus of ear, external auditory meatus, and skin over meatus and tympanic membrane. It also divides into articular branch and superficial temporal branch. The second branch of posterior division is lingual nerve. It supplies anterior two-thirds of tongue, mucous membrane in the floor of the mouth, and gingiva on the lingual side of mandible. So the third branch of posterior division of mandibular nerve is the inferior alveolar nerve, the most important nerve in dentist life. So inferior alveolar nerve, it enters into the central cavity of mandible through mandibular foramen. Before entering, it gives a branch called mylohyoid nerve, which is a mixed nerve. It supplies to the anterior belly of digastric, mylohyoid muscle, and sensory innervation to the inferior and anterior surface of mental protuberance, and sensory supply to the mandibular incisor at times. And through the central cavity, it provides innervation to mandibular third molar, second molar, first molar, and mandibular second premolar and first premolar at. Then it exits the central cavity through mental foramen as mental nerve, and it supplies skin of chin, skin of lower lip, and mucous membrane of lower lip. And in the central cavity, it continues as incisive nerve, which supplies mandibular incisor, mandibular lateral incisor, mandibular canine, and mandibular first premolar at times. That's it. These are the branches of trigeminal nerve, and I don't want to trouble you up with the course and all those, but just remember there are 4 nucleus for trigeminal nerve, which is located in pons in 2 different columns, an afferent column and an efferent column. Afferentனா என்ன, efferentனா என்னன்னு பார்ப்போம். Afferent விஷயம் வந்து நம்ம மூளையை அஃபெக்ட் பண்ணுற விஷயம். ஸோ இட் இஸ் டுவர்ட்ஸ் பிரெயின். எஃபரன்ட்றது வந்து நம்ம அந்த அஃபெக்ட் பண்ணுச்சுல நம்மள ஒரு விஷயம், அதை வந்து நம்ம 2 குத்து குத்தணும்ல, ஸோ இட் இஸ் டுவர்ட்ஸ் மசில். ஸோ அஃபரண்ட் இஸ் டுவர்ட்ஸ் பிரெயின், எஃபரண்ட் இஸ் எஃபெக்டிவ் டுவர்ட்ஸ் மசில். ஸோ த நியூக்ளியஸ் இன் afferent column are superior sensory nucleus, spinal nucleus, and mesencephalic nucleus. And the nucleus in efferent column is the nucleus of fifth nerve. And from here, that is from pons, the nerve travels anteriorly towards the petrous part of temporal bone where the trigeminal ganglion is located, and here it divides into three different branches which we saw previously. இதெல்லாம் தான் புக்லேயே இருக்கே, நீங்கள் என்ன புதுசாக சொல்லிட்டீங்க அப்படின்னு நீங்கள் கேட்கலாம். I'm going to tell you the significance of trigeminal nerve on dental practice. If a patient comes to your dental clinic with a pain in some region of oral cavity, you should first know the nerve which supplies the particular area to make your diagnosis right. And if you are planning for extraction, you should anesthetize the particular nerve which supplies that particular tooth to make your treatment successful. So I request you all to recall and remember trigeminal nerve then and there to shine bright like a star in your practice. Thank you. Please do like, share, comment and subscribe and keep supporting. See you all in next video. Bye.